Right, Megan Briede, Director of Programs for Save the Children South Africa, joins us now. Megan, a very good afternoon to you. A devastating story. I mean, just listening to the Department of Social Development in the Western Cape, saying that it has recorded just over 70 cases of child abandonment in the period from October last year. I mean, this is just but one province. And of course, not all of those have been children who were dumped and left for dead. But how widespread is this across the country? Just speak to us about what your organization has to deal with in as far as this discussion is concerned.
Yes, so child abandonment is a growing problem, and we're particularly noticing it in the big city centres. What we estimate across the NGO sector is at least 3,500 children could be abandoned every year, and the majority of those, 65% on average, are below 28 days. So these are newborn babies, and the majority of these babies do not survive. So it is a growing concern for us.
And that's a big number, because when you consider that there is a life on the other side of that particular number, you speak, of course, of these children that are being abandoned every year. What is their fate?
Well, for the majority of newborn babies that are abandoned, if they are left in unsafe areas, as you've just heard, in the veld, in dustbins, these children are not surviving, and that is a great concern. For children that are abandoned and picked up into the welfare system, these are children that will be placed in child and youth care centres, temporary safe care, while awaiting the possibility of adoption. The challenge with abandonment for children for adoption is that it's a more lengthy process of proving that the child is actually abandoned, that no parent's going to come forward or is looking for that child. So these are children that only go quite late into family care. And that, of course, has ramifications for a child.
Absolutely. Of course, one of the challenges that this country faces is high unemployment. We've also heard in that clip that poverty cannot be ruled out in some of the decisions that are made when it comes to child abandonment, as well, of course, as the price of unemployment. Essentially choosing to abandon your child or leaving them for dead. I mean, what do you think needs to be done here in as far as that is concerned, in as far as avenues for those that simply cannot take care of children to know that they can leave them somewhere instead of now possibly facing a criminal charge?
Yeah, absolutely. So I do think that, yes, poverty is our biggest driver. And of course, the added driver is for very often it's a mother left alone to care for the child. I think one of the gentlemen earlier was mentioning the fact that men are not stepping up or taking responsibility for that unborn child. So the financial stress is even harder. Very importantly, though, I think for the way to address these services is when we look at our healthcare system, you can access medical care during your prenatal times. You'll get all the right care from a health perspective, a physical health perspective. But we do not have systems in place that are asking, for example, a teenage mother, how are you going to care for this child? Who's going to support you? Do you know that you have other options like adoption? And I think that that's one of our challenges. So if we could build services into the clinics that focused not just on the physical care, but actually the emotional, mental care and the planning for the future of that child.
And how do we do that, Megan? I mean, from a service perspective now, because oftentimes you'll find that your healthcare providers are really the first line and presumably safe line of contact for some of these mothers. You mentioned, of course, teenage mothers. We know that teenage pregnancy in this country is quite high. It probably has to do a lot with GBV related cases. So in that instance where from a preventative perspective, clinics and hospitals play a vital role, what systems do you think should be in place?
I think we definitely need to better resource our facilities and ensure that we have social workers that are more available to engage with pregnant women and then be able to problem solve with them. We also, of course, need to raise awareness. We need people to understand that there are options, that you can approach your Department of Social Development. But that being said as well, we need to ensure that as professionals, nurses, social workers, we're open to providing that support. And we don't go to old-fashioned views and values which say, you shouldn't have fallen pregnant in the first place, or, it's wrong to abandon your child, put your child up for adoption. So that stigma and discrimination needs to be cleared out from our discussions with these mothers.
Yeah, especially because of the high levels of crime in this country, where we know most of these children have been groomed or are raped, notwithstanding, of course, that there are those teenage pregnancies by teenagers too. But in the case of, you mentioned earlier on that the red tape, once these babies are born, those that can or do have the potential to make it and live longer, what can be done there to minimize that red tape, especially if, for instance, there is a police case that has been opened against that particular child who was abandoned?
So first of all, when it comes to adoption, if a mother signs consent for the adoption at the time of a child's birth, then it runs smoothly. You can actually look at children being placed in families basically from birth. So that's where we're talking red tape. When a child is abandoned, there needs to be the police investigation. So you need to, first of all, try to track and trace the parents of that child. And it's not just about the criminal case, it's about the long-term care of that child. Because if you do not do your track and trace properly, there could be a grandmother, there could be a father, there could be an aunt and an uncle looking for this child. And now you move ahead and place the child in adoption, and the people appear 6 months later. And now you're in this dispute on what do you do for this child? Who should be caring for the child? So the process actually has to be quite lengthy to determine that this child is definitely a child who doesn't have any additional carers who are wanting to step in and take up that responsibility. So the law is pretty clear. It gives social workers nice, clear guidance on the steps to take. What we need to do is rather be saying to mothers, rather just come forward, say you want an adoption, let us place your child as soon as possible, and sign the papers. And that we need to remove the stigma of that.
Yeah.
As communities, we need to say to young mothers, and even mothers, older mothers who are not coping financially, rather bring your child, let us help you.
As with all socio-economic, crimes, there's just so much complexity around them. But Megan, thank you so much for your time. Really do appreciate it. Megan Briede, Director of Programs for Save the Children South Africa.